Parents coming into my surgery telling me their child's got an itchy bottom is a really, really common occurrence. What really upsets me, for their sake, is that parents are horrified when I tell them by far the most likely cause is threadworm. People dread the idea of getting an infestation, and threadworm is far and away the most common infestation in the UK. It is passed on very, very easily. It's passed on, like so many other things, by what's called the feco-oral route. In other words, the threadworms live in your gut. When you poo, wipe yourself, use your hands, don't wash your hands quite as thoroughly as you might do. Things get stuck underneath your fingernails. They get swallowed by you, or you touch somebody, someone else touches that and puts it into their mouth. It's not a happy thought, but I'm afraid that's the way it happens, and that's why hand washing is so absolutely essential. Threadworms don't harm you, but they do cause symptoms, usually when they come out of your gut. So you swallow the eggs, they then grow, takes about 2 weeks to become adults, and then live in your large colon, your large bowel, for about 6 weeks. During the course of this, horrible though it may seem, the average female worm can lay about 10,000 eggs. She normally comes out of the bottom and lays the eggs around the bottom, around the outside and the skin outside the bottom at night when it's nice and warm. So that's why one of the most common symptoms is itching around the bottom or itching around the vaginal area if it's a girl. Sometimes that scratching can cause inflammation and infection with a germ which gets in underneath the skin. So those are going to be the most common symptoms, itching around the bottom in boys, itching around the bottom or the vaginal area in girls. How do you tell if you've got an infection? Well, you can't always, but one of the ways is to look at the poos. Sometimes you'll see little white pieces of thread, basically like white cotton thread, about 1/2 inch long, which won't necessarily be wriggling by the time they get there. Sometimes, if you wait till your child's asleep, fast asleep in bed, and just part the buttocks very gently, you can see little threadworms coming out. Now, the good news is they don't cause any fundamental damage. They don't burrow through the gut wall like some exotic infections from Africa and so on do. And they're relatively easy to get rid of. What you need to do is to treat everybody in the family with a single tablet, one single dose for anyone over the age of 2, probably repeated a couple of weeks later. That's the easy bit. I'm afraid the tough bit is preventing getting reinfected, because these eggs can survive for quite a long time. So to begin with, same day you take the treatment, really big spring clean. Change all the beds, change all the towels. Do not shake out the towels or sort the laundry in the bathroom, because those eggs can be sprayed everywhere, including onto your toothbrushes, where they go straight in again. Horrible thought, I know, but it happens. Do make sure you wipe all the surfaces really, really well. If your child's affected, or any of you have got threadworm, tight undies at night will reduce itching and also reduce the spread and likelihood of getting eggs underneath the nails. Cutting fingernails short, using a separate towel, and everyone in the family having separate towels, and general hygiene measures, being really careful about hand washing, having a bath first thing in the morning, but then washing your hand really regularly during the day, especially before you touch food. It's not anything to be ashamed of. It's a fact of life. They are very, very common. Kids between the ages of 5 and 9 are most likely to get them, but because they're so infectious, I'm afraid you've got a good chance too.